I'm Tammy Harvey. I'm a nurse practitioner and proud nurse from Hobart, Tasmania. I'm part of a team of 8 nurse practitioners that cover 3 services in Hobart. That's the hospital in the home service, the community rapid response service, and inpatients in a district hospital. My background is emergency and trauma, and I have secondary training in gerontology and aged care. My innovation is a nurse practitioner-led model in a district hospital, and it was originally started in 2018 as a shared model with a geriatrician, aiming to increase bed occupancy in the short term, and it's evolved and now well-established model and is now a GP nurse practitioner shared care model with a full multidisciplinary team. We take acute and subacute inpatients under a restorative and rehab model with the multidisciplinary team, and the patients use a goal-focused approach to their management. So what's the impact of our model? Well, for the patient, they feel happy, they feel valued, and they feel part of the plan. We have reduced falls, delirium, pressure areas, and other iatrogenic complications due to the restorative focus of the model. And it's an absolute pleasure to see patients thrive under this model. At a hospital and community perspective, we've increased bed occupancy in our district hospital from 50% to above 85%. We've got a better use of rural facilities, and we've increased capacity and capability of rural services. And we've got staff that are keen to work within our model, especially GPs who are keen to work within a primary care model as well as a district hospital inpatient model. At a systems level, we've increased bed occupancy at our hospital, which then has a positive impact on flow and bed access at the Royal Hobart Hospital, which is our one and only public hospital in Hobart. And although we have longer length of stay for our patients, we're able to take complex, more comorbid patients, and through a multidisciplinary and team approach, we help to address areas of functional decline and increase functional capacity, which hopefully has an impact on unexpected representations and admissions into the future. At a nurse practitioner perspective, we're showcasing nurse practitioner-led models in 3 successful services. We're promoting nurse practitioner role progression amongst our nursing colleagues and demonstrating that nurse practitioners are able to be a valuable part of multidisciplinary teams. I'm incredibly honoured and humbled to be recognised by my peers and organisation for this model of care, and excited that the Australian College of Nurses have recognised it as a Trailblazer nomination. So my advice to other nurses and nurse practitioners is to know your why. Seek out different ways of doing things within your model or your organisation or your team. See how things can be done differently if you know that they can be done differently. Try and seek out other services or teams that have perhaps looked at different models like this and find out their key learnings and avoid making same mistakes. And share resources, share knowledge, share support to be able to move forward with innovative models, and be a leader amongst your team and be confident with your ideas, and go and find your decision makers so that you can try and make change.